April is Child Abuse Prevention Month, and it is also referred to as Blue Ribbon Month. The blue ribbon actually came historically from a grandmother whose child was beaten black and blue, and it was to call attention to that. So now we recognize April as Child Abuse Awareness or Child Abuse Prevention or Blue Ribbon Month. And what we do, we try to do as much public awareness, so we go into churches, to civic groups, to anybody that wants to hear how they can go in and report these things if they notice it. You know, we're all not required by law, but to me, we're all morally responsible for our children. I'm Jana Bailey, the Executive Director of Child Protect Children's Advocacy Center. Child Protect is the Children's Advocacy Center in Central Alabama, and we serve 3 counties, Montgomery, Autauga, and Elmore counties. And our mission is to provide a forensic interview, counseling, and advocacy to children when there are allegations of abuse.
Child Abuse Prevention Month is one of the most important times of the year for the Child Advocacy Centers. That's really our time that we're able to bring our stories to the forefront of the public's eye and let them see what it is that we do, to let them know what our services are, and to make them aware about how they can prevent child abuse in their communities, because at the state level, we're all about helping communities respond to abuse. My name is Gina South, and I'm the State Director for the Alabama Network of Children's Advocacy Centers.
The Children's Advocacy Centers were actually started in Huntsville by Bud Kramer. He was a congressman who retired about 6 or 7 years ago. But before that, Bud was a prosecutor in Madison County. And as he was prosecuting child abuse cases, particularly child sex abuse cases, by the time it got to trial, he realized that the children had been traumatized over and over again by the number of times they had to tell their story. They may tell a teacher and then a principal, perhaps a school counselor, maybe a school nurse, then the DHR workers, the investigators, prosecutors.
And so what he envisioned was a multidisciplinary team that would come together that would allow the child to tell the story one time in a safe environment where the child would not be re-victimized. And then that multidisciplinary team that's made up of all the people who investigate the case and prosecute the case and treat the child, that all of those people would come together and make a decision about how do we take this case on and how do we bring it to fruition so that the child is able to receive justice and the child is able to receive counseling.
There's actually about an 80% higher prosecution rate when a child has gone through the advocacy centers as opposed to those who haven't. So we know we are providing, one, an excellent venue, an excellent environment for these children to come after they've been through something so horrific as sexual abuse. And we have the trained professionals who know how to talk to them and where the child will open up and talk about their abuse.
Originally, the Child Advocacy Centers began as an organization that was a child-friendly setting and a child-friendly atmosphere where children could come and tell their story one time, and it was primarily for victims of child sex abuse. But today, we see a lot of victims of all different kinds of trauma, whether it is they were a witness to a violent crime, or if the child was sexually abused, or if they were a victim of some other kind of abuse, whether it was physical abuse or severe neglect cases. Those will all come to the Child Advocacy Center.
Typically when they think of child abuse, they think of physical abuse, but they don't really think about the mental abuse or the emotional abuse or the different other forms of abuse that aren't necessarily visible.
We provide a tool for the law enforcement, whether it's the police or the sheriff, and the Department of Human Resources in our counties. And we provide a forensic interview. That is really where we see the most children. Almost 600 children every year, we provide a forensic interview. And that just means that we have trained staff who are trained specifically to talk to children, to ask them questions in a non-leading, non-threatening way, so that they're able to help the law enforcement investigators discern the truth in the allegations.
And so in the other room, we have that multidisciplinary team that's made up of law enforcement and a mental health provider and usually someone who is a representative from the district attorney's office and they'll be together looking to see if there are any other questions that they need the interviewer to ask.
Secondly, we provide counseling to children. We kind of liken the forensic interview to the emergency room. So the child goes and maybe gets a cast on their leg, and that's when they tell initially what happened. But the counseling really is where the children are healed. They go through maybe 6, 10, 12 sessions of counseling where they're able to work through their feelings. It's like I said, leaving the cast on or the stitches in for those 6 weeks, that we know that it will always be a scar there. But if you do all of these steps, then the healing will be a lot better. And thirdly, we provide advocacy. Now, the advocacy starts from the time that the DHR and law enforcement call in the interview. And then when the family comes, we have an advocate that does intake with them. And it's not just a matter of going over paperwork, but it's really finding out what else is going on with that family. There may be domestic abuse going on. There may be alcohol. Mom may have just lost her job. There are a number of things that come out when we do the intake with the families right when they get here. And we don't just leave it at that. When the case is getting ready to go to trial, the advocate is there throughout the entire judicial process. We meet with the district attorney and we provide a court school with that child and the family. We walk through the courtroom. The child gets to sit on the stand. We get them familiar with what it's going to look like, because even though they've talked about it and it's recorded, the child still has to testify, sadly. I mean, that's just one of those things, but we want them to get familiar. And then the day of trial, our advocate is there all day with the children or the child and just comforts them, and it's a remaining source, a remaining friend that's been there since the very beginning.
Funding is very difficult for all of the child advocacy centers to come by, and that's why we're so grateful for agencies like ADECA, that ADECA is our primary source of funding for all of the 33 CACs in Alabama.
We do get money from VOCA, which is Victims of Crime Act. It's a restitution that is paid into a fund, and those funds are funneled to our state through ADECA, and then they are administered to agencies that provide services to victims of crime. And obviously, children are victims of crime, of abuse.
During the 2014-15 fiscal year, we administered $2.5 million to 36 different agencies. And during the 2015-16 fiscal year, we had a rise in the number that we got from the Department of Justice. So we were able to administer $3.9 million to 42 different agencies throughout Alabama.
Whether it's a VOCA grant or whether it's a donation of $5 from somebody locally in the community, it all goes for direct services of children.
One other thing that we do is that we collect all of the state statistics for all of the child advocacy centers. For example, in 2015, we conducted 6,991 forensic interviews across the state. So that's really representative of the number of children that came into the Child Advocacy Center.
Child abuse doesn't happen 8 to 5 and Monday through Friday, so we're on call 24/7.
Child abuse crosses every single racial line, ethnic line, every socioeconomic line. There's not a group of people that is exempt from child abuse.
We had a case last summer, and it was a little girl who was 8 years old and had been molested by her stepfather. And she went through the entire process. She came in very sad, very upset, talking about the abuse at the forensic interview. Her mom was very supportive of her. She came back for counseling, didn't miss a session, went through the court, had the support, got through the court, testified, did great. Her last day of counseling, we always do an end of the counseling party or a little celebration that they've arrived somewhere. So they get a certificate, and we make a really big deal about it. At the end of that, she brought us a school picture of herself, and on the back she had written in her 3rd grade handwriting, "Thank you for giving me my smile back."